Following a large series of studies looking at different forms of brain stimulation, it is now currently recognized that this group of therapies does have a role to play in the treatment of major depressive disorder. With new findings from Cole and colleagues, we can see an example of the next phase of brain stimulation research in the treatment of major depressive disorder. The authors use a new form of transcranial magnetic stimulation, or TMS, to implement a procedure called theta-burst stimulation. And they use this technique in patients with treatment-resistant major depressive disorder. Moreover, the authors combine this new technique with brain imaging data to tailor the brain stimulation therapy to the underlying biology of each patient. And not only do the findings provide important preliminary insights about a novel treatment, but they give clinicians a glimpse into the future about how the next generation of brain stimulation therapies might be used. Research on epigenetics is particularly exciting because this demonstrates the ways in which the environment and genes interact. Some of the most interesting research looks at the transmission of risk factors from parents to their children. And this examines patterns of methylation in the FKBP5 gene. In a new study from Bierer and colleagues, the authors examine the relationship between exposure to the tremendous trauma of the Holocaust in parents and the epigenetic profiles in their offspring who were never exposed to this terrible trauma. And the findings suggest that it might be possible for aspects of experience that a parent undergoes in their life to be transmitted to the genes of their offspring. These important findings are going to increase interest in examining the interplay between genes and the environment in shaping risk for emotional problems.